Hi again, everyone. This is Dr. Kusuma from Suria Cosmetic Surgery. Soon getting recognized, I'm somewhat humbled as Faces by Kusuma or the Face Doctor of South Florida type of branding, and so I'm going to own and accept that because I do love doing facial rejuvenation surgery, and I feel tremendous amount of gratification to see these transformations that are just stellar and stunning. So one of the questions or maybe concerns or fears that many patients have with full face rejuvenation is when we do eyes, people worry about getting dry eyes, where they feel gritty or they just feel uncomfortable with dryness. And so I want to show you guys why dry eyes may develop. So if you look at this image here, the white part of the eye is nice and clear. The eyeball itself is nice and bright. The edges of the eyelids are exactly where they need to be, and you have a little triangle here, and you have the inner part of the eye nicely defined. In the space, the corner is nice and sharp. There's a nice fold. Everything looks good. The lashes look good. So this is what we consider a normal eye. This person just happens to have green eyes, but it could be a brown eye, it could be whatever color, blue eyes, etc. They're just ethnic, genetic kind of thing. I just happen to find this, so this is what I'm showing. So typically, when you do eyelid surgery, you have incision along here. Sometimes you have an incision along here. At the bottom, you have an incision inside the eyelid as well. And there's a nice covering of the eye called the conjunctiva. You can get pinkish eye when the conjunctiva gets inflamed. You could get yellowish discharge and stuff like that for various conditions, but generally this is the way the eye should look. You can imagine when you do surgery around the eye, you can get swelling, which is very, very natural, right? When you do surgery, you can get swelling of the conjunctiva. And on the top part of the eye, right here underneath, deep underneath here, there's a gland called the lacrimal gland or the tear gland. This gland produces the tears that are very necessary and normal part of functioning of the eyeball, the eyes itself. And the lids, like windshades, when they close and open, they channel all of the tears across the eyeball, across this, this eye itself, and comes to the inner part of the eye right here. The eyelid itself is very much stuck to the globe or the eyeball, and they're in touch with it very gently, and the conjunctiva actually goes underneath this little base of the eye underneath and kind of rolls on itself. So it's nicely covered with a very beautiful membrane called the conjunctiva. The gland produces the tears and goes across the eyeball. And right here on the top lid and the bottom lid, you have these little small holes that are essentially tubes naturally that evacuate the tears and then they drain into the nose. So for the eye to function properly, the tears need to get produced. The movement of the eyelids and the blinking of the eyelids cause all of those tears to go from the outside part of the eye all the way across and lubricate the eye itself and then drain out, and it's a continuous process. So you can imagine when you have surgery and when you have swelling and the lid may not be touching the eyeball and it's kind of opening up a little bit, the eyelids are not closing enough like you normally do, and you're not blinking enough because you're swollen. All of that mechanisms are disrupted short term, right? So you can imagine when you have swelling in the eyes and you have stitches around the eyes and your eyes are not fully closing, and because they're tight and maybe they're swollen, you yourself are not blinking at a pace that you normally blink, because normally we don't even think about it, but we blink. That's just normal function. And some people blink faster, some people blink slower. When you're watching a television screen or an iPad screen or an iPhone screen, look at me, I have 3 devices already here. You're constantly staring at the screen and you're not blinking like you normally would. And that's exaggerated when you have surgery, because now you have sutures and you're swelling and you have pain and discomfort perhaps to some short period of time, and you blink a lot less. So the flow of the tears across the eye is not happening as nicely, and since the surgery causes swelling and the lid may come outward a little bit microscopically and it's not touching the globe, you have these pools that can form where the tears are just sitting there and not moving across and lubricating the entire eyeball properly, and they're not draining as well as they should. And so all of these can cause temporary problems with the tear flow, I should say, not production so much, but the tear flow and tear evacuation, and that can lead to dry eyes. Okay, these are very temporary and normal phenomenon that happen after eyelid surgery. To compensate for that, we recommend putting lubricant, an ointment that can stay for a long period of time and lubricate the eyeball itself, like I talked about, because it's not flowing across properly. At nighttime, if you're not fully able to close it temporarily because of swelling again, we try to lubricate it so it doesn't get dried out. We tell you to put something to kind of close your eyes shut so that you're not exposing your eyeball to the natural elements, so that whatever tears there are, they're not evaporating prematurely because they're exposed for a very long period of time, especially because you're not blinking. All right, so we recommend putting eye drops, recommend putting eye ointment, we recommend closing the eyes. We also recommend people to purposely blink every minute, certain number of times, so that you are forcing your body, almost like doing physical therapy for a broken leg or for an injured leg or an arm, so that you're doing these functions without, so you don't get joint stiffness. Similarly, after eyelid surgery, we recommend people do blinking purposefully 10 times, 15 times, whatever you can, so that you're forcing that function, normal function, so the tears are functioning properly. And within about a week, 10 days, short period of time, the physiology starts to return to normal. And when that happens, everything goes back to normal. So dry eyes are temporary usually. They disappear in 7 to 10 days. Some patients need a little longer period of time, but we always recommend people to be hyper vigilant and do these small mechanisms of blinking, of making sure you cover it up at night so that you don't have any exposure, evaporation, and dryness, that you put ointment and the lubricants, eye drops, etc. The redness relievers that people use are not good to use long term. Okay, it's like Afrin. When you have a nasal congestion, people use Afrin spray to open up the eye, open up the nose, and it works great. Very short term, but you can get addicted to it and you get rebound problems if you stop it after a long period of time. Similarly for eyes as well, we don't want to use this long term. We want to use it very short term, very purposefully during surgery and right after surgery. And after that, you should go back to normal and kind of get back to your normal routine of whatever that is. And staring screens for a long period of time without blinking, sitting in front of fans and air conditioning directly where you get that wind and exposure that causes dryness, all of those create issues for dry eyes. So some small functional habitual changes can help tremendously with prevention and minimizing at least dry eye problems after surgery and during surgery. Okay, hope that helps, which is a common thing that people ask about.